Hello.
Hello, this is Paul.
Hey, Paul. Thanks for
Yes,
hopping on
can
the
you hear me?
phone. Yeah, can you hear me?
Sure. Yeah, I
Great.
hear you.
Awesome. Well, thanks for hopping on the phone. My name's Greg. I work for a single-family office called Tarsadia Investments. We're based out of Newport Beach, California. We do a variety of kind of public and private investing in the life sciences space. So we have a number of portfolio companies as well as some investments in the public markets, all kind of in companies that are either marketing currently commercial or in pre-commercial human drug development. And kind of related but a little bit different, we're looking now at an opportunity in the animal health space. And so wanted to talk to some experts in the space to get smarter on a number of things. And I can kind of go through our, a few questions in a minute, but basically, what does the regulatory pathway look like, and how does it differ from that for human drugs? What's the kind of cost and timeline to bring a drug through development? How is this different from vaccines, which go to the USDA, and other drugs, which go to the FDA? And also marketing, and sort of commercialization. Once the drug is approved, what does the scale up look like? How much does it cost? What do these sales forces look like for animal drugs, as well as some other questions. So that's kind of what we were hoping to get a little bit smarter on. So I think the purpose of this call would be just to ask you some questions and get some of your opinions on some things. And then also we're looking to bring in a consultant for a sort of a deeper diligence process that we're conducting. And so that would be kind of a 4-ish week engagement where we would ask our consultant to work maybe 1 to 2 days a week, helping us answer key questions around an opportunity, dig through some data room documents, and potentially come out to meet management with us. So that's the setup.
Okay. Well, do you want to hear a little bit about my background, maybe, to help you understand what what the fit is for your question?
Yeah, absolutely.
So I've spent most of my career in the human drug side, so the pharmaceutical side, and later in my career, and this was always not in research and development or regulatory. So I never worked in those areas, and I have limited experience around it. But I've always been in the operational side, after in the human health side or the animal health side after approval. So when drugs are approved and then on the market, I worked in the operations, manufacturing the drugs.
Okay.
So that's kind of it in a snapshot. I have been involved in spinning off a division from Pfizer, and I was on a team that was leading the separation of the veterinary medicine business, and then became a vice president of operations in the veterinary medicine side under Zoetis.
Yeah. No, very, very familiar with Zoetis. Okay. So then maybe, I can direct my questions more towards what your area of expertise sounds like. So, we've spoken to a number of experts and some former professionals at Zoetis and some of the other kind of big animal health segments or companies. And one thing, kind of a recurring theme that we've heard, is that when you compare it to human drug development, the biggest kind of single point of failure for these animal drugs is at the CMC point in terms of getting approval, meaning that safety and efficacy, when you compare to a human drug, is less of a hurdle than actual manufacturing and getting that